When low back pain creeps in or the back spasms, life can go on hold indefinitely. A proactive approach is the best solution to lower back pain. Enjoy these tips to release the spasms and keep them from coming back. Finding the thoracolumbar trigger point can be a little tricky, but stick with it. It's sure to become one of your favorites. What we're going to do is feel for a nook between your spine and your ribs, about 1.5 inches out from the vertebrae. So what I'll do here is I'll place my hand on the door sill and I'll push with my left foot and take weight off of my right foot. As I'm doing this, a lot of times I'll feel a little bit of almost numbness going down my right leg as I'm doing the right side. That's a really nice feeling. This is kind of a hurt so good. I'm not massaging or going up and down. I'm just putting pressure into that trigger point. This is great for releasing the QLs and the erector spinae, those large muscles in the back that control the stability and often are involved in a spasm. So as I'm pushing like this, I might do this for 30 seconds or so. If I'm really experiencing a problem in the area, I will continue on the area for maybe 2 minutes, practicing some deep nasal breathing, and then I will just simply go to the other side and do exactly the same thing, where I will be pushing with my right foot this time and taking weight off my left foot so that it has no bearing weight on it at all. Again, I'm feeling a little bit of a sensation running down my left leg, and this is having a conversation to calm the nervous system, block pain signals from the brain, and ultimately release that spasm from my lower back.
So this area experiences a lot of tension. It can get very stiff, and I'll refer to it as hypomobile, or think of it as lack of mobility. So if we start in this area, we can go from the thoracic spine up to the cervical spine, or out to the scapula and the shoulder, or from the thoracic spine, work our way down into the lumbar spine. So we're going to demonstrate on Eric how to just get this going. So position ourselves on the Backmate. He's using the roller balls at this point. That's going to have a little more broad surface area so as to decrease the overall pressure. If we wanted to increase pressure, we can change and substitute those out for the gliding discs. He's going to roll I'm going to refer again to these as segments of the thoracic spine. He's going to roll like 3-inch segments throughout his thoracic spine. We can adjust the Backmate to go higher or lower depending on which segments of the thoracic spine you'd like to get. You're going to spend about 20 to 30 seconds in each area. As you're doing that, feel for the relaxation of the muscle tone that's been built up over the course of the day.
The quadratus lumborum, or QL. It connects the hip to the lumbar spine to the lower rib cage and is critical for stabilizing the spine. When the QL is angry, it can generate a ton of pain. The QL is a deep muscle, but I can lean into the Backmate aggressively by bracing with the door frame and utilizing the acute disc roller to generate a ton of force. I'll make movements up and down to massage the area, or stop and hold and breathe through trigger points to loosen and lengthen the QL.
Just as we've talked about the thoracic spine being a primary restrictor of mobility into the cervical spine, guess what? Go ahead and turn around. Our primary restrictor is not going to be in the back, it's going to be part of our hip flexors. Our hip flexors connect onto the spine and to the pelvis, and those muscles being overactive or too tight, because they attach onto the lumbar spine, can be responsible for that low-grade back pain that most people get here. So we're gonna find this is called our ASIS, or our little pelvic bone. We're gonna go just inside of that. That's where our iliopsoas is going to reside. So we're gonna go right in there, and all we're gonna do is a direct pressure in through there. So I'll have her get in that lunge position again. That's going to put the iliopsoas on a little bit of a stretch. She's just going to shift her body weight forward, put pressure in there. As you do that, it's going to be a deep feeling of almost like a little ache, but that's getting into those hip flexors. Those hip flexors, again, are attaching onto the lumbar spine and pelvis. We're going to go ahead and let those release. Spend about 20 to 30 seconds on this. You can even spend up to a minute if you'd like. This is the tensor fasciae lata, or TFL. So we can go again to that ASIS, that bony prominence that we were looking at. for the iliopsoas, we went in here. For the TFL, we're gonna go here, go out laterally and down a little bit. There's a big bulk of muscle, and Janelle will go ahead and adjust the Backmate to a more horizontal position. And then same thing, you can put direct pressure, and even with this one, you can start to roll up and down